A bearded man with glasses interviews in a white room. Text: Kevin Vagey, PhD, behavioral scientist, CDC. In the bottom right-hand corner, a logo for the CDC appears, featuring an abstract bird made of human faces in profile.
Intervening in a hospital setting is a unique opportunity to reach young people with support when they need it most. Brief interventions can help young people develop problem-solving skills and connect them to essential services to mitigate harm and protect them in the future.
Blue graphic lines slide away to reveal a rounded building column with a capital M on it and text reading, North Campus Research Complex, University of Michigan. Text in the bottom right reads, Ann Arbor, Michigan.
As a physician, my early days of standing in the trauma bay, seeing kids who we sent out and then we failed and come back and see them in the trauma bay, sometimes bleeding to death and knowing that we hadn't done enough, and that's very motivating.
A blonde woman interviewing by a wall covered in a stone mosaic presses her lips together. Text reads, Rebecca Cunningham, MD, Director, University of Michigan Injury Center. A young man in glasses strides through automatic doors into a waiting area. He sits down and scrolls on his phone.
Injuries are the leading cause of death for 60% of teens and adolescents and children throughout that early age of their life, and we're working to decrease those numbers.
Text: 60% for youth age 1 through 19 nationally. Cunningham, NEJM, 2018. Near a desk, a group of hospital staff, including Rebecca, stand in a circle having a discussion.
The SafERteens study is an evidence-based, one-on-one, 30-minute brief intervention.
One of the women from the discussion group interviews in the room with the stone mosaic. Text reads, Jessica Roche, MPH, Research Specialist and Project Coordinator, SafERteens.
That we do with youth that come into the emergency department for anything.
In the young man's treatment room, another one of the women from the discussion group shows him a tablet. He takes it and taps on the screen. She smiles and talks with him.
We approach people, get informed consent, then do a 30-minute brief one-on-one session with them, talk about their goals, what they want out of life, their experiences with fighting, and then go through different role plays with them to talk about different skills that they could use to either avoid fighting in the future and think about those things.
The young man reads a pamphlet entitled Community Resource Brochure. A brunette woman with glasses interviews in the stone mosaic room. Text: Maureen Walton, PhD, MPH, Associate Professor, University of Michigan. She and Rebecca stride through a lobby together.
The notion behind this is this public health model where instead of waiting for someone to enter a treatment center or a criminal justice setting, why can't we take interventions and bring them out to kids in a prevention-focused way, or from young people who are experiencing some risk behaviors, and do interventions to really change their trajectory in life.
Outside, students follow a sidewalk lined with snowbanks. The young man smiles at Rebecca from his hospital bed. Jessica interviews.
With this intervention, it's a lot of times the first time that anyone's asked our youth what they want out of life and what their goals are, how they can achieve those goals.
Rebecca sits beside her patient with a clipboard out and talks to him.
So once we start talking to our youth, sometimes it's like a faucet turning on and they get really excited and they really want to process that with someone who really cares and understands them and has confidence in them that they can achieve their goals.
The young man taps the tablet in his treatment room. Outside, a giant capital M emblazons the back of a blue scoreboard. Wrought iron fences read, Michigan Stadium. The hospital staff in their discussion group smile.
When we initially started, people said, kids aren't going to want to talk to you about violence. Well, they're there for their belly pain or their foot. And we found that to be completely not true. Nobody else is talking to these kids about the violence that they're experiencing in their life. They want to talk about it, and when given the opening in a safe space by trusted professionals who are non-judgmental, and are not blaming them, they open up and they're very, very much want to talk to us and sometimes don't want to stop talking to us and would like to come back and talk to us again about this.
Rebecca and Maureen talk by a window near a snow-covered stone wall. The young man opens to a page in the brochure labeled Tips to Stay Safe and Avoid Fights. A man in a U of M lab coat talks in the discussion group.
They then see the emergency department as a place that cares about them as a whole person and understands all of what's going on in their life, not just about what they're there for that day.
A glass window in a break room reads Injury Prevention Center, University of Michigan, beside their capital M logo. Jessica interviews.
It's really great that we have an evidence-based practice that can really be used throughout the country now to prevent youth violence.
Maureen types on an open laptop, then interviews in the stone mosaic room.
In addition to reducing peer aggression in our study over 1 year, we also found that the intervention reduced involvement with peer victimization, as well as dating victimization.
In a conference room, Maureen sits by Rebecca at a table covered in open laptops and papers.
We also find that it reduced consequences related to violence, which is important, and these include things like injury, missing school, and having interpersonal conflicts with friends and family. And finally, the intervention reduces alcohol-related consequences because it focuses on risk factors for violence, which include mood as well as alcohol and other substance use behaviors.
The young man strides from his treatment room and down a hospital hall. Maureen smiles.
We're really committed to making this intervention part of the sort of real-world clinical care, and I feel like that's really exciting.
Blue lines flash past. The CDC logo appears alongside a booklet with hexagonal images of smiling people. The booklet is titled A Comprehensive Technical Package for the Prevention of Youth Violence and Associated Risk Behaviors. National Center for Injury Prevention and Control. Division of Violence Prevention. Text reads,
SafERteens is one example of an evidence-based program in CDC's Technical Package to Prevent Youth Violence. Use CDC's technical packages to prevent violence in your community.
www.cdc.gov/violenceprevention/pub/technical-packages.html